I'm back, and I have better lighting. Hi everyone, it's Chardonnay Kisses bringing you another episode of Safer Sex with Chardonnay Kisses. Today is May 7th, so if any of this information has changed since then, I apologize for the inaccuracies, and I'll put an update in the comments. Um, so today's episode is actually about how to have safer sex during these times. These are tricky times, these are quarantine times, and these aren't very fun times, but some people are still having fun. But you might be asking, should I be having fun? And well, that's a little complicated. So I'm here today to talk to you about sex and the coronavirus and what you can do to stay safe, sexually healthy, even during these corona-filled times. So this presentation that I'm reading from actually comes from Equitas Health, and they got their information from, let me look real quick, New York City Health Department. So again, this came from the agency that funds me to do these videos in drag. So I'll begin. So the first thing is, know how COVID-19 spreads. So you can get COVID-19 from a person who has it. That is the biggest thing, but that's also a tricky thing because you may not necessarily know who has COVID-19. The virus can spread to people who are about 6 feet apart when that person coughs or sneezes. So if I'm 6 feet away from you and I or sneeze, that's putting you in the danger zone. It's like, ooh, you're in danger, girl. So 6 feet apart, always try to stay 6 feet apart from people. The virus can spread through direct contact with saliva or mucus of someone who has the virus. We still have a lot to learn about COVID-19, especially when it comes to sex. COVID-19 has been found in feces of people who are infected with the virus. It has not been found in semen or vaginal fluid. Again, this is as of May 7th, 2020. As we know, we do know that other coronaviruses do not efficiently transmit through sex, but that's not to say that COVID-19 could. So we're still learning about that. I will say from personal experience, this is not in the report, by the way, during my college years, one time I hooked up with somebody and they had a cold, and did I get that cold so fast? So I think there's no quicker way, in my opinion, to get someone's sickness than to have someone who has a sickness. So, because you're all close together, body parts are touching, fluids are touching. So, again, I think it's best when you can avoid sex. But not everyone can avoid sex. But if you want to avoid sex, just remember, have sex with people close to you. And with that, you are your safest sex partner. And by that, I mean masturbate. Masturbate, masturbate, masturbate. Masturbation will not spread COVID-19, especially if you wash your hands and wash your sex toys as well with soap and water for at least 20 seconds before and after sex. So again, pleasuring yourself is one of the safest ways to stay safe right now. That seems redundant. Safest way to not get COVID from someone else. So be your own pleasure partner. I think with that, wash your hands. The next safest partner is someone you live with. Now, that being said, everybody's situation is different. Maybe you're living with a boyfriend or sex partner who is currently unemployed or is not in exposure. On the flip side, you might be living with someone who they're working retail, or they're working in the medical field, or they're working out in the public and they see the public all the time. So if you are going to have sex with someone you live with, make sure they're being safe as well, and they're practicing social distancing and wearing masks and that sort of thing. You should avoid close contact, including sex, with anyone outside of your household. So ideally, I know you're real thirsty right now. I'm real thirsty right now. I think America's real thirsty right now. But as tempted as someone like that whoever it is on that dating app looks, you err on the side of caution. It's probably best to not hook up during these times. If you usually meet your sex partners online or make a living by having sex, please consider taking a break from these. Again, there are other ways to have intimate stuff with others. There's videos, phone sex, sexting, film yourself doing sexy things for a partner, or chat rooms. There's lots of other ways you can stay safe without actually having to meet someone. So That being said, if you are having sex, please remember that kissing can actually spread through COVID-19. So avoid kissing anyone not a part of your small circle. Um, we're not 100% sure, but we do think rimming might spread COVID-19, especially since, as I said earlier, they have found traces of COVID in feces. So be careful with that. Condoms and dental dams will reduce contact with saliva or feces, especially during oral and anal sex. Washing up before and after sex is more important than ever. Washing your hands is basically the theme of 2020, so wash your hands before sex, wash your hands after sex, 20 seconds at a time. Find a 20-second tune to sing to yourself. That kind of helps me. I believe the Golden Girls theme's 20 seconds, and everyone knows the words to that, so that's something you can sing to yourself. Same with your sex toys. Please continue to wash and disinfect them. Another big thing is washing your keyboards, your video game controllers, anything like that, or you're disinfecting your phone, especially any device that you're using for pornography. So, another big point: skip sex if you or your partner is not feeling well. Can't stress this enough. If you or a partner may have COVID-19, avoid sex and especially kissing. If you start to feel unwell, if you think you're developing symptoms, which again, symptoms can include fever, cough, sore throat, or shortness of breath, you may want to seek medical help. Also, you may want to skip sex if your partner has a medical condition that can lead to a more severe COVID-19. So, again, if you have a partner that maybe has asthma, lung disease, heart disease, diabetes, or for example, if they're HIV positive, but their HIV is unsuppressed and they have a low CD4 count, those people are at higher risk for COVID-19. So it'd be best if you have those conditions to not engage in sex with someone, because those will put your conditions at an even higher risk if you get COVID-19. The other big thing is prevention. Obviously, you will make these decisions yourself whether you want to have sex or not, and that's totally fine. But just remember, even if you're not thinking about COVID-19, which you should be thinking about COVID-19, there are other things. There's still HIV, other STIs, unwanted pregnancy. So big important thing is if you are going to engage in sexual activity, use condoms or PrEP to stay safe from HIV. If you are HIV positive, take your meds so you can get a undetectable viral load, which those are things we'll be talking about in future videos. To protect yourself from other STIs, make sure you're using condoms, dental dams, female insertive condoms as well. And for pregnancy, make sure that you have the effective birth control that you find the most helpful. Again, these are scary times, but we will get through these. We've gone through harsher things, I feel like, in life, and the human race has surpassed a lot of hardships, and I think we'll get through this. It's just about making good choices, knowing what to do. I know it's very hard right now, especially if you're cooped up and bored, but in the meantime, trying to masturbate until the things are a lot calmer, unless you are, again, living with someone that you already know is safer for COVID-19. But again, if you can, just masturbate until this all blows over. But if you are going to engage in sex, do what you can to keep yourself not only safe from HIV and STIs, but from COVID-19. So thank you for listening today. I have more exciting videos coming up in the near future. And I love this little line you can see. Oop, gotta love wigs. Thank you again, everyone. Love you all. And until next video, stay safe and wash your hands.